Shanae says, "Hi, Raf. Hope you're well. I have a question about dislocating your knee. I teach dancing, and one of my students dislocated her knee last week just in a lunge stretch. She's seen 3 different specialists and they all told her that she has to have surgery to get her ligament pinned back or something, otherwise she would keep dislocating her knee. Is surgery the only option for dislocating? She's only 13, so I thought maybe there might be another option for her." So from what you say, I can't be certain, but my assumption is that you're talking about a dislocation of the patella, which is the kneecap. And so the kneecap is held on by strong ligaments on either side, a medial ligament and a lateral ligament. Medial is towards the inside of the knee and lateral is towards the outside. And they're called the medial patellofemoral ligament and the lateral patellofemoral ligament. And the patella also sits in a little groove inside the femur, the thigh bone, called the trochlea, and it slides up and down. And most commonly when it dislocates, you didn't say what was the case with your client, but most commonly when it dislocates laterally, so it slides laterally. And so that means that the medial patellofemoral ligament is stretched. And sometimes that can be because people have maybe just, through random genetics or whatever, a more shallow trochlea, a more shallow groove in the femur so that the patella doesn't sort of sit as deep and so it's easier for it to dislocate. And sometimes it can be for other reasons. So I did a bit of a literature search, and what I found was that for skeletally immature people, people of the age that your client is, you're talking about, she's 13, she's still growing, her skeleton hasn't finished growing yet, that for first dislocation, if this is the first time this has happened, she's got a pretty good chance that it won't happen again. Whereas if it does happen again, after they dislocate the second time, it becomes very likely that it will continue to dislocate. It will become unstable, basically. At which point, surgery to repair the medial patellofemoral ligament is probably the best option. And that's what I found in the literature. So my recommendation would be, based on that, strengthen her leg, avoid, whatever position it was that she was in when she dislocated it for a little bit, and then gradually move her back towards that over, the next maybe 2 to 3 months. Strengthen her leg, her quads, her hamstring, just do lunges and squats and those types of things with her. And if it doesn't dislocate again, great, no further action required. But if it does dislocate again, probably I would agree with the surgeons that surgery is probably the best option. And if this is not the first time that it's happened, if it's happened previously, well, then I would probably agree that surgery is the best option. So hope that helps.